Hello, everyone. This is Dr. Mary Lauder, and you are listening to the Since You Put It That Way podcast. It's the show that examines various health, wellness, and medical topics from unique perspectives. We will be having discussions and guests that will cause you to pause and consider, well, since you put it that way. Hi, and welcome to another episode of Since You Put It That Way. I'm your host, Dr. Mary Lauder. Today, we're going to be continuing in discussions with our physical therapist, Megan Pass. We're going to be talking about fascia. Fascia is the connective tissue that surrounds and supports all parts of the body, muscles, organs, nerves, joints, bones, and it plays a crucial role in movement and function by providing that support, as we talked about, helps to reduce friction. And it also transmits not just mechanical tension, but we find there that it's driven by hormones, it's driven by the nervous system, primarily the autonomic nervous system, that fight-flight mechanism, and influences from our environment. So I think that this is going to be a great conversation, and it's going to open your mind a little bit. It's going to cause you to pause and say, since you put it that way, which is our fun tagline with this. And I hope that you enjoy the discussion and communication and conversation that I have with Megan. Thanks for tuning in, and always remember to both review and rate our podcast. That helps us to understand what you're listening to and your feedback, and helps us also to do a better job. Thanks very much, and enjoy the podcast. Well, hi, Megan. Welcome back. How are you today?
I'm doing so well. Thank you so much for having me back for another conversation. Really excited about this.
Yeah, you're very welcome. So I think, fascia is something that, as we describe it, as we're going to talk about it, really, we're going to have multiple podcasts about this. And pretty much every conversation we bring in, whatever we talk about together, will involve fascia in some level. Mm-hmm. So first, Megan, give me what your working definition of fascia. What if I'm a patient and I know nothing? What would you say to me? What's fascia, Megan?
So fascia is basically an organ, but I only say that because it's encompassing. It's the connective tissue that holds you together. It's the 3D spider web that helps give your soft tissue shape. So it's the web, like the cobweb, but then within that web is your cells and the extracellular matrix, which is all of the fluid and that is outside the cell that also helps create our shape. So most people think about fascia as like the fuzz, that YouTube video that went viral about this is what fascia is, or they talk about where you peel that thin sheet off of a chicken breast. Well, that's only one type of fascia. Like fascia is all encompassing. Like how do you think your organs stay in place in your belly?
Fascia.
Fascia.
Oh, okay, good.
Yeah. Like what gives your nose its shape and helps connect it to the bones on your skull?
Cartilage and fascia.
Cartilage and fascia, but fascia helps create that connection between the cartilage and the fascia. And what also goes through cartilage and then goes into your bone?
Fascia.
Fascia. So if we want to think about it on a really simplistic way, fascia is in every place in your body, within every organ, every bone, every cartilage, tendon, muscle, ligament, etc.
Okay.
It's truly the connective tissue that holds us together.
Okay. So that sounds very structural in its description.
Well, I am a physical therapist, so that is where I go first.
Right. Okay, great. So, and then I'm the functionalist in the group, apparently. So, because structure and function always go together.
Yep. So then when I start talking about so you asked when I first introduce fascia to people. That's how I first introduce it.
Yes.
Is because it's the best way for people to like grab onto it. Once I start working with movement and we start looking at, okay, how does the movement and how does our fascia work with our movement? Then that's where function comes in. And function of posture, function of how you choose to move your leg, function of how you even choose to open your mouth. Choose consciously and subconsciously. Fascia is the director of all of that. And then because fascia is our extracellular matrix, that fluid, it also decides like, how is it going to hide toxins, or how is it going to help with the flow of fluid through your body, or how is it going to help with all of the ways that your body just functions, but then movement can help facilitate your fascia health, or it can decrease your fascial health. It just like
Okay.
there's consequences for it all.
Okay, so then that's some function. The other function is how embryologically, when we were developing, fascia developed with the blood vessels and with the
Mhm,
nervous system, and it ran parallel with that.
mhm,
So then translation, as we grew, it intermingled.
mhm,
And so then you've got that function of fluid transfer through the fascia, and then you get the diffusion of the cells,
mhm,
which you get that free fluid, which then goes back into the lymph, which then is emptied into the veins, which then is part of the circulation.
mhm,
So also, if fascia takes that and sends, say, from the abdomen to the heart, it's sending a message. Fascia is sending a message from the abdomen to the heart, and it tells the heart to do something. If it's full of, say, inflammatory messengers like cytokines or C-reactive proteins or leukotrienes, which are all part of inflammation, guess what? We've just defined an endocrine organ.
yep,
'Cause an endocrine organ and a hormone is something that takes a message from one part of the body to the other.
mhm,
And fascia lines the blood vessels.
mhm,
It's in the blood vessels.
mhm. It's in
Okay.
everything.
Yeah.
And this is why I say fascia is an organ. I started training in myofascial release in 2014. And at that time, they Dr. Gimberto was just starting to come out with all of his videos where he's a hand surgeon. He's a French hand surgeon, and he has been videoing fascia. And if like you can find him on YouTube, and what it showed was fascia as a living structure, as a living thing. And yet, the minute we die, our fascia no longer has function. And then when you go into a dissection lab as a healthcare provider, it really is that fuzz to get out of the way because it just like all of the embalming just stops it. And yet, when just as you said, embryologically, that makes no sense as a living human.
Mhm. Right. So then, I'm just pausing. I told you this might be a pause cast instead of a podcast. So, what is so? All right, I'm jumping off a ledge here, both feet, head first. Is that where the soul is?
Oh, is that where the soul is? I think it's a piece of it. I believe our soul is anchored in every area of our body.
Mhm.
And there are anchor points in various places. In my work, I have seen with myofascial release, people access past life memories.
Mhm.
People access somatic responses that they didn't know were there,
Mhm.
suppressed memories in this life trauma that they've forgotten about and are able to process through. So, is it the soul or is it the mind?
Yes. How's that for an answer? Yes. So I tend to lean towards it being the soul because I see the soul as responding to the echo or being an echo, responding to the call going outward as well as the call coming inward. I see that the soul having, being bi-directional or multi-directional, really, probably more than two, with respect to how it's functioning and responding. And the reason why I wonder about the soul and fascia and the mind and fascia is because the memories, you're right, can be hidden there. Trauma's hidden there. One of the things I was looking at in terms of fascia says, well, it works in suspension, protection, retention, separation, shock absorption, and pressure attenuation. All of those words are protective.
Mhm.
So the fascia is protecting us as well. And so I wonder if that's just not where all the fight or flight stuff is held, is in the fascia.
I have been actually sitting with this very inquiry over the last couple days because is that where the fight or flight is held, or is that where we've been programmed into this fight or flight? Because the people that I know who are the most heart opened, most embodied soul essence, who take care of their body temple, their fascia is healthy
Mhm.
and it functions and it's thriving. So is all those words regarding protection, but is that the dis-ease of fascia?
Mhm.
Because fascia, I think its purpose is to allow our greatest function and
Yeah.
to allow us to have the greatest ease and flow in our life. And ease
Yeah.
and flow is the connection to the divine, which is the soul. I think of the soul as like a antenna receiver,
Yeah.
and it's the signal that we're getting.
Mhm.
And so it makes me wonder more about like our psyche and what we're programmed as humans, as Homo sapiens,
Mhm.
and our how we are wired through our DNA,
Yeah.
and then that marriage to the soul and that fascia
Mhm.
really truly being the access to both.
Yeah. I, I
Because
I fully agree. And so in some places, and as we're recording this, in case anybody hears pitter patter, we have a thunderstorm in the as we're recording this. So great for the rain and great for the recording. So um, and so I think maybe in folks who encounter trauma in such a way, traumatic events in such a way that creates the trauma in the body. The highest and the most free they could function could be to a moderate level because that's just all things that unfolded for them. So I would agree fully, and we might just be seeing a continuum of function relative to being really super free, healthy, and fascia flowing and moving and grooving and all that kind of stuff, and then hangups in the fascia.
yeah. Yeah.
So practically, I think of when I was trained, in physical therapy, athletic training, everything was kind of linear. We moved our joints in a plane of motion that occurred with the joint, typically, meaning your knees a hinge, so you extend and flex, extend and flex. We moved our shoulder in a windmill, plus to the side abduction, across the body adduction, flexion, extension. And we didn't really think much about fascia until they had all of a sudden a frozen shoulder. And then they did stuff called PNF, proprioceptive neuromuscular facilitation, which moved in neuromuscular fibro, more fascial patterns, even sort of. Yeah.
Yeah.
So, but there's an evolution. I mean, so, people know that they can lift a kettlebell, they can go to the weight room. What do you recommend for, if a person's doing pretty well and wants to keep their fascia in good stead? What would you say?
So I think where I go is what mobility work is being done, because we live in such a culture that is like go, 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 go and get stronger, get stronger, get stronger, and get stronger. And yet, um, how flexible are you? Like, how much pain do you have in your day to day? And, this is where I'm a lover of the yogic traditions and Pilates. I am a Pilates certified instructor. And it, coming into the more repetitive and subtle and stretching. Like fascia with strength training and people who are feeling really strong. And now I'm talking more to like the people who are strong.
Yeah.
Like if you have knots or you feel tight, your fascia is not healthy.
Mhm.
It's
Right.
limiting you, it's protecting you.
Mhm.
Where if you feel free and can move easily in your body, then your fascia is fairly healthy. And
Mhm.
so I think it comes down to we just had a big slam outside.
Yeah.
um, I think it really comes down to just how do you feel? Do you feel loose, open, and free? And if you feel loose, open, and free, then your fascia is doing well. If not, then it comes down to some really gentle stretching and sustained stretching
Yes.
and holding it like we're talking like 5 minutes, people.
Yes.
A lot of fascial stretching out there says 2 to 3 minutes, and really that just means you get through the first collagenous barriers. The chemical change starts to happen to allow your extracellular matrix to melt uh, at about the 5 minute mark. And so it's being in that stretch and sinking deeper and deeper in a way that your body can handle and you can still breathe. You can
Okay.
still take good breaths and your nervous system is calm. You're not freaking out because, and then like really letting it sink in and finding the mobility in that way. It's to me, it's about slowing down and being present within your body, allowing yourself to feel your body and being okay with whatever you feel, whether that's discomfort or whether that's ease, and letting go of the judgment of it. And this is why I believe the fascia is the mind, because a lot of people, they get into a stretch and they're like, no, I can't do it. That hurts. Or, oh, I'm going to hurt myself. And I tell people, like, your body isn't going to betray you. Like injuries happen because of repetitive trauma where you're pushing, 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 and you're not listening to your body, or injuries happen because you fall or have like something big happen. Like you're not going to stretch into an injury if you are paying attention to what your body's telling you. And so at least I've seen patients do it when they force a stretch, but if you stay gentle in the stretch, it can't really happen. Like
So you're asking them to tune into their body.
bingo.
Okay, so 97% of what we do every day is in our subconscious.
Mhm.
Okay, so we've got to activate that 3% and expand that.
Mhm.
Now, genomically, when folks do our genomic test, we can look at some genes that might lend them towards soft tissue injuries,
Mhm.
interestingly. We can look at their genes involved with recovery. We
Mhm.
can look at genes that help point towards endurance or power activities. And so what I talk to them about is, okay, you're more endurance. You don't want to go to that fit class and throw the tire around because you're not a power person, you know? Or if they are really power, that's great. Um, and so then the interval training is what you need to do over here. And then the stretching becomes looking at what you can pay attention to, what you can be mindful about, and learning even what a tolerance is.
Mhm.
And so I have people go up to that pain and then back off just a little bit and then
So,
lean back into it.
yeah, that's one way to do it. I generally teach it, where do you feel the first gentle pull? Because I don't have the genome testing in front of me, and there are pathologies that stretching can actually cause injury, including Ehlers-Danlos syndrome, which
Yes.
seems to be on the rise. And so I actually have them just go to where you first feel that gentle pull and
Huh?
then wait there. And then if that disappears, sink a little deeper, sink a little deeper. We still want to feel that tension. And then and then I just walk them through it and we do it together. And some people are like, oh, it's really hurting. And I say, okay, what does that pain feel like? And so it is exactly what you're talking about, is bringing people inward into our bodies and to remember that our bodies are here. Like we are not our bodies, we are our soul. And yet our bodies are here to work with us in conjunction for whatever we're here to do on this earth.
Right.
And so really, truly, it is about learning to feel your body and to feel your fascia.
Okay, so I just kind of had this little epiphany. We get injured because we're not connected to our body. And the
Mhm.
way to heal is to actually connect to our body.
Yep. That's my job in a nutshell.
So, had we been connected to our body, we might not injure our body.
Mhm.
Okay. So, all right. So that makes perfect sense. Okay. So let's look at an injury. Let's look at a fall and go boom. Okay. Somebody slipped on the ice. We live in the Midwest, fall and go boom, right? Midwinter, you're
Yep.
hustling through out from the grocery and kaboom. You slip on the black ice
Yep.
and you land on one side of your cheek, not the other. So you land on your right buttock.
Yeah.
Walk me through what you see, how you unwind, and just kind of give us an overview of how this fascia drives all that.
Yeah, so that's actually a really common fall, and then coming back to what you said, you're rushing and you're hurrying and you slip and go boom.
Yeah,
So once again, an injury comes because we aren't paying attention,
right.
and subconsciously or consciously. And so being in that present moment, you would have seen the black ice, most likely, if you're truly in that present moment and you were educated to see what black ice is. So like it so just to like drive that point. But then, okay, what would I do? Someone falls on their right cheek. I first look at posture and alignment, and let's see where your bones are, because fascia holds your bones in alignment. Your bones don't hold yourself in alignment. Your fascia
What?
holds your bones in
Wait a
alignment.
minute, wait a minute, wait a minute. What? Say that again?
So fascia holds your bones in alignment. Not your bones holding your bones in alignment, but what's attached to your bones? Fascia.
Mhm.
Whether that's in the form of ligaments, whether that's the form in tendons, whether it's in the form of fascial sheaths or nerves exiting your spine, or blood vessels or lymph, like it's your fascia. And so your fascia is what holds your bones in position really strongly with our pelvis and our spine and our shoulders, because our shoulders are just floating.
Yeah.
So so I look at that. I look at their standing posture first and foremost. If someone comes into me and they fall boom, I go, okay. And then I also listen to their story, because their emotion and what they told themselves about their story plays out and how their fascia is responding and how their fascia is going to allow them to heal. And this comes back to the mind and the soul living in the fascia. And so then we do an assessment. And my first thing is, let's get pelvis in alignment. And it usually takes anywhere from 5 to 8 minutes. It's a really simple technique. It usually doesn't hurt. And then we can start assessing spine and hip and knee. But if that pelvis is not in alignment, then we have just created a unstable foundation.
Well,
So think of
so
a crack in a house.
yeah, so pause there for a minute because what I see when folks come in as an acute injury, then as a physician, we call it a sprain. Yeah. And
Mhm.
so we sprained it. We sprained our low back. All right, work with me on this, Megan. You did three eye rolls. That wasn't a one eye roll. That was three. So, okay, so there's a sprain. So you've got an acute inflammatory. This is what we're taught. So let's walk
Mhm.
through this.
Yeah.
Taught that it's an acute inflammatory reaction, ligaments, muscles. Rarely do we talk about a bone being bruised, and
Mhm.
tendons and soft tissue.
Mhm.
And sometimes a person could develop a bruise from the fall, and what we feel is muscle tension on one side more than the other, often.
Mhm.
We feel that, and we see that the range of motion, meaning bending forward, hurts. Sometimes they're leaning because everything's in spasm.
Mhm.
And so then as an osteopath, they come to me for an adjustment, quote unquote. They come to me for a treatment. They come to me. Sometimes I can't even get at the tissue because it's just hard as a rock.
Mhm.
And so then how I approach that is ice, heat to break up the pain spasm cycle, and NSAID, or so that would be like an ibuprofen or naproxen, and then maybe a muscle relaxant, then go away and come back in a few days and we see what we can do.
Yeah, I mean, in when I practiced in
I'm not
Oregon,
challenging you. What
no,
I'm doing is putting the two
the two side
paradigms
by
together.
side.
Yeah,
Yep,
yeah,
and I totally agree with you. In Oregon, because I had direct access, like very quick direct access in my practice act versus here in the Midwest, um, I would see more acute. But what I found was if I gently help their bones come back into alignment, the spasms decrease significantly.
right.
And then if they didn't, then it was like, okay, let's get a physician on board to help out. So it's just another example, everyone, that there are multiple ways to treat. There are multiple ways to address injuries. And and your response that you're going to get is going to depend on the practitioner you choose to see.
Well, and the other thing too is so you do the slip and fall, you get up, you get the groceries home, you're kind of sore, but you think, oh, I'll just put a little ice on this, I'll take a Tylenol, I'll take an ibuprofen, I'll go to bed. You'll see what happens. They get up the next morning, they can hardly move.
Yeah.
So through no fault of their own, and just through really regular conditioning of how we've taken care of ourselves, we get kind of stuck.
Yeah, and I think that comes into exactly what you said, the conditioning. I mean, I think about I have a young daughter, and her response to pain, my mom tells me it was the same as mine. She falls, she like looks around, sees if anyone reacts, and then goes, "Huh, that hurt." Okay, and gets up and continues moving on. And so it's like she just accepts it as a fact of life. It's really only for her if there's scraped skin and she ends up bleeding. And so it makes me then wonder, like, as a kid or as parents, like, how can we help build this resiliency that if an injury happens, how do we like what do we do to take care of our bodies? In my house, I was taught, oh, you fall, okay, you keep it moving. And you're going to be quote, I'm picking this up from living out west, stoved up
Yeah, yeah, yeah,
the next
yeah,
morning
yeah.
until you get things moving again. And once they get moving, then life feels better. I mean, I know I have that, and I'm not like, I'm good middle aged, and in the mornings, like, I feel a little stiff, and then I get moving and things feel better.
Right.
And that's just magnified to the 100th degree when we have a slip and go boom.
Yeah. So, so what I'm hearing you say then it's get to care sooner.
Mhm.
And then if they, is there something that they can know to stretch a certain way for low back, one side versus the other, that they can get into those deeper stretches, just to see if that can help them? Or do they really need this to be guided?
So here's the thing about an acute injury. That's where I don't do fascial stretching. I
Oh,
don't.
yeah.
Because and the reason it comes back to what you spoke about with the embryology at the beginning, where fascia is like in that same extension of our nervous system.
Yeah.
And when we have an injury, our nervous system is already on really heightened awareness.
Yes.
And so if we're in a lot of pain and we're already in that heightened awareness, I'm not going to say, let's do fascial stretching right now,
Right.
because that is enough to send most people off the deep end.
Okay.
So then that is about creating stability, turning on your muscles that have turned off because of the pain inhibition response,
Yes.
which is a very normal thing. And that is about doing and I have a very specific set of exercises that are coming out in a course soon about how we can turn the stability back on after an injury and in the morning so that our brain can remember what it's like to be stable. And then when our brain remembers what it's like to be stable, then we can get into some fascial stretching.
Right. So the key is to keep moving, really,
Yeah.
too. So if they fall like that and they can't get in to see someone for a few days, what I, could make an assumption about would be walking would be helpful as long as there's not a lot of pain with walking, right?
Mhm,
Don't carrying things on your back or, satchels and things that lean you one way or the other, right?
mhm.
And maybe some things basic like what?
You
What
know,
else?
ice and heat is great, depending on whatever helps your body feel better, because it's a nervous system downregulation.
Yeah,
So it's, which is what walking does. Now, when you fall and go boom and you wake up the next morning, you're like, I can't move.
yeah,
Notice that scared response, like that is actually going to make things tighten up and even more. So that's why movement is good that feels safe. So walking is a great one.
yeah,
Cycling, if that's something that people enjoy and you can, like, it doesn't hurt. Like,
yeah.
I always tell people, like, if you're doing something for 5 minutes and your pain is about the same or slightly less, you're doing exactly what your body needs to do.
Okay,
If the pain increases, then we're going, okay, it's not quite safe for your body. And then it's ice or heat can really help decrease that scared response, which heightens pain. Um, I can't recommend NSAIDs because I'm a physical therapist, but like it's a very common use. And get in to see someone,
right.
but also know uh, that a lot of the time you're going to feel better in about a week to 2 weeks.
So if it's also in the nervous system and it's a fight or flight, because it's going to be your scared response is your fight or flight.
Mhm,
That could be where, we've got the self-compassion and connection.
mhm.
And the statement goes, even though dot dot dot, you fill in the blank, I deeply and completely love, trust, and accept myself. I choose to connect and reconnect with myself. And what I have found in doing that, that brings literally that concept of dissociation. It brings that person back into connection with themselves. And we do
Mhm.
see a decrease in pain because we do a pain response level, subjective level, before we start that and say that statement. And then we repeat a couple statements otherwise. And we literally can get people from like a 10 down to 3, down to 2, and then they can get up and walk around. And we haven't even touched them.
Yep.
I haven't applied osteopathic treatment. I
Mhm,
haven't stretched them. I haven't realigned their sacrum.
mhm.
And we've reached that through the concept of the fight or flight or scared cycle or scared response, rather.
Yeah, and I'm just gonna say it. We as humans are meant to exist in love,
Hmm.
and first and foremost, self-love. And that's what you just said. Like, even though dot dot dot, I deeply and compassionately love myself.
Hmm.
And that that is where healing is. That's where the magic is.
Right.
And that's where I believe we all can heal ourselves. And when we get stuck, that's what we're here for. Um, but truly, if love can heal,
Hmm.
and and that is the soul work
Right.
of this place. And that is truly the union of the soul into the physical form, to
Right.
embody the soul into the physical form. When we are in the fight or flight, and when we're in the fear and the pain, and that's all we can feel, we're just going into separation. We're
Yeah.
just going into, oh, that's not me, that's not me, that's not me. And you're also disconnecting yourself from love, which love is the divine. Whatever name, I'm going there.
Yeah.
And whatever name we want to give
Yeah.
the a higher being. And so in this love, we can heal.
Mhm. Yes. Well, and that, the body has a self-healing capacity, the
Mhm,
wisdom, and is wired and designed for self-healing.
mhm,
And we don't sit around and watch a cut heal. I mean, we could if we have nothing else to do, but that's not our best job. You know,
mhm,
we might clean it up after we get a cut, bring the edges together, put a Band-Aid on it, and then check it in the morning. But we're
mhm.
not like, I'm sorry, I can't come outside tonight and play because I'm watching my finger heal.
Well, and that's like the magic of our body
Yep.
is we don't have to watch it heal.
Mm. It knows inherently what to do.
Bingo.
Okay.
And so I like ultimately, yes, I do fascial work. Yes, I teach movement, but It's really what has shifted so much in the last 8 years of my career is connecting people into their body
Yes.
and allowing themselves to feel, and then once they can feel, you have choice. Without awareness, you have no choice.
Yeah.
And then that choice is then where truly the magic happens. Like, I can release fascia all day long, and it will truly, honestly only hold if the person's energetics are able to shift with the physical release.
Yes. I fully agree with that. And the same thing that I see when I treat chronic illness. Unless I get into the emotional component, the reconnection of themselves back to their body, and the gentle observation versus the loud judgmental
Mhm,
criticism, then we can actually bring healing and see the body actually heal
mhm.
versus coming up to so far and only getting so far.
Yep.
So it sounds like we've got lots more things to talk about. I mean, I'm thinking areas of chronic pain, chronic swelling, different things that drive autoimmunity and how that affects fascia and all that kind of stuff. So, and then I think breaking down some of the things that you're developing now, the exercises, the different programs, the Pilates and the stuff that
Mhm,
you're bringing forward now, I think is going to be really crucial because I see, more and more people really two things. They want help, but they want to figure it out themselves. You know why? Because everybody's Googling it, right? If
mhm,
they didn't want to figure it out, they wouldn't Google it, right? But
mhm,
that also tells me they're not getting answers.
mhm.
Okay, well, guess who? We've got two people here who have lots of answers, and we get paid for our opinions. That's a joke, folks, but we do get paid for Trust me, I have lots of more than enough. I am that.
Don't we all in our society get paid for our opinions?
No, no, uh-uh. And when I started to get being paid less for my opinions, I left that system because I thought my opinions were really worth something. So, so I think that that's really important. But okay, so I think though, in getting your physician, your provider, your physical therapist, get them on your team. Get someone you can talk to, spend time with, really problem solve and work at it, and also understand the choices that you have as a patient. Understand the choices that you have, and I know you love this word, Megan, the sovereignty you have as an individual.
Mhm,
And we translate that into medical terms called informed consent. Same thing. But I look at that as a sovereignty too. What are your choices? How do you want this to look and how do you want to go forward?
mhm.
So I think what we need to do go forward is just to prepare more podcasts on fascia and talk about things and I think it would be fun to go into neck pain and jaw pain and just really kind of pick apart that whole pain concept and that pain spasm cycle and the pain response that we have and really look at that and kind of break things down of a lot of the common things we deal with all the time.
Yeah, it'd be really interesting. Headaches would be another one I would throw in there.
Totally fun.
Yeah.
Yeah, and then I think we have to go totally tubular, meaning hollow and solid organs, talking about the different organs in the body and the effects of fascia on the organs.
Mhm.
Was looking at that, and that's just here. So here's a question. We'll lead, so is the heart a hollow organ or a solid organ?
I would say a hollow organ.
It is. Oh, extra credit. Good job. How about the brain? Hollow or solid organ? I mean, think of it. People are kind of thick.
I would say it's a hollow organ because it
It
folds
is a
in on
hollow organ.
itself.
You're exactly correct.
And it has the cerebral spinal fluid that now I'm really forgetting my neuroanatomy, but in the
Yeah,
center of the brain.
exactly.
So, yep.
Okay, so the difference between a hollow and the solid organ are the hollow organs are dense, they have more cells and increased oxygen requirement. So think of kidneys, spleen, liver, gallbladder, not gallbladder, but pancreas, excuse me. And then the hollow organs are going to be like your stomach and your intestines, tubes, bladder, potential spaces, things like that. And of course the heart and the brain. Good job. Extra credit for you. My goodness, that was really good. So, and it's interesting because the fascia goes inside and around all of these organs, it also pulls on that. So the question I have is, how does that influence chronic illness, hypertension, cardiovascular disease? Megan, I know you're just going ping, ping, ping. So we're not just going to be talking about, falling and going boom, but we're going to be talking about really the fascia and how it affects our entire being. So that's going to be really fun.
Yeah, it's going to be really fun. And it's for those who are like going, wait a minute, how does physical therapy do this? There are many teachers and trainings that have been around for 40 and 50 years that have been teaching PTs and massage therapists how to do this. And osteopaths are probably the first ones that were accepted and in the medical field as the manual modalities too. So for those who are like going, wait, no, PTs don't do that. Yeah, we can.
Yeah, you can. Yeah, and so that's all visceral.
Mhm.
All that, and so the guts are called visceral, the organs are called visceral, so we call it visceral manipulation. So visceral fascia. So that's going to be really fun to go into that.
Yep. That's a
So,
really fun one. And I also really love to talk fluids with fascia. So just
oh,
it's just
okay.
which is for you guys, that is like blood pressure, like circulation,
Yeah.
swelling, all of that. It's a really important concept because fascia supports our hollow organs very much so because fascia itself is hollow.
So potential, I'm just going ding, ding, ding. Potential. So for folks who are borderline for things, not malignant hypertension, where you're like 200 over 120, but if
Yeah.
you're 140 over 90, if you're 137 over 85, there's ways to change that fascia to bring that down. If you're on 2 blood pressures, could we get you to 1 blood pressure medicine? Yeah, yeah,
And I've had patients where that has definitely happened.
yeah.
And I know from myself when I first started as a practitioner of myofascial release, I got a ton of treatment because, like, how do you learn? You get it done to you, and
Yeah.
then you do it.
Good thing you
And
weren't a surgeon. You had a
yeah,
bunch of surgeries.
no, thank you. And I know my blood pressure dropped from like 120 over 80 to 105 over 65. And
Yeah,
that just felt really, really good and really easy. So, and that like, so that is just something that happens because if we increase our mobility, it's going to decrease the pressure on our fluids
yeah.
and then things can flow easier. To give everyone just a little bit of a teaser there.
All right. Oh boy, we got lots to do, don't we? Okay.
Mhm.
All right. So we better sign off today so we can come back and do this again another day. Thanks to everybody who's been listening to Since You Put It That Way with our physical therapist, Megan Pass, and myself, Dr. Mary Lauder. And Dr. Pass, as she goes by, really will come back, or Megan, Dr. Megan, will come back and continue this conversation. So thanks very much. See you guys next time. Thank you for joining us on the Since You Put It That Way podcast. Today's episode was written and produced by Crowded Table Productions. Technical editing, Malin Long Lopes. Sound editing, Jonathan Fiegel. Music, The River Jordan, written and performed by May Erlewine. Please rate and review our podcast as well. We appreciate your feedback, and hey, be positive, share the love.